Hey, my name is Ryan. I'm a nursing student at Bon Secours Memorial College of Nursing, and this is my submission for the Older Adult Health Promotions Project. So I actually had a lot of fun with this one. The client that I interviewed and performed our home health assessment on, I may slip up and refer to her as Nana sometimes. We're not related, but to anyone that is or is not related, she is Nana. So, but the client, is actually in incredible condition for her age. She is 71 years old. She has a very short list of medications that she is on. She's on an ACE inhibitor and also just some baby aspirin. Uh, she is actually extremely active and holds independence to a very high priority. Everything can be viewed as just her fight to remain independent because that's how she lived for pretty much her entire life. Um, so, our main concern here has been her risk for falls. I gave her the nursing diagnosis, risk for falls as evidenced by her age, over 65 years of age, and lack of knowledge of her environmental hazards. So, in her pursuit for independence, a lot of what she's obtained is a kind of invincibility complex where she's just gonna live life like she does normally. It's been working for her so far, so why should anything change? So I expected a lot of stubbornness going into this, but I was actually pretty pleasantly surprised. She has a high school education, but she's actually consistently gone back and done various writing courses and everything like into her advanced years of age. So she loves to learn. She likes being talked to as an equal. I'm sure like everyone else does. And it was really beneficial for us to come up with a aligned goal, and our aligned goal was to continue her independence but in a safe manner, and everything that we were doing was in the common goal to prolong her availability of independence. So I wanted to teach her a bunch of different methods for preventing falls, and also what to do during a fall. Um, and being that she had taken a lot of courses, I felt like a lecture style was probably the most beneficial for her. Um, so I used a variability from just doing my own research and presenting it to her, and also through YouTube videos. So I actually found a great Stanford YouTube video that was created mostly by occupational therapists in teaching clients like preventive fall measures, the reason why people fall, and just kind of removing that element of shame about it, like that you now have a crutch that you need to deal with. It's not the case. It's the same reason why any other health complication can occur. You're just in a more vulnerable population for it. So approaching it in that way was actually very beneficial. Um, so I'll have the link down to the YouTube video that I used below, and also in my notes. And it covered a variety of topics, but it was about an hour long, and she actually really seemed to be well captivated in it. It actually gave questions in between sections, and so it was more engaging for her, and she actually took part in those, and like we'd pause it around the times that she had questions. But she's also very active in her church group, and she is doing all of her sermons online, so she's very used to like the internet format as far as education and just paying attention. So another thing that I covered in the videos, as long as a lot of the other research that I did, was pointing out fault hazards. So a couple of pieces of the research that I carried into my teaching was one by the CDC. Reported that 1 out of 5 falls causes a serious injury, such as broken bones or head injury, and then it listed out kind of major conditions that make people more susceptible to falls: lower body weakness, vitamin D deficiency, difficulties with walking and balance, use of medications such as tranquilizers, antidepressants, vision problems, foot pain, home hazards, broken or uneven steps, throw rugs, which is bafflingly common, and most falls are caused by a combination of risk factors. Um, So one thing that really jumped out to me was the supplementation, and like I said, she has a very short list of medications that are just prescribed by her physician. Nothing is really supplemental or preventative. As far as like everything that she has is just for her hypertension or just common elevated blood pressure. But so what I did is I pulled out a list from the Open Orthopedics Journal of essential nutrients of bone health and their availability in the average American diet. And it pointed out many ones, vitamin D and calcium, a common. So I got her a bottle of vitamin D and calcium because she is religious with taking her medications. Like, she is honestly just a spectacle. She is so active. She works out regularly, which is also part of the reason why we need to do these fall preventions, because she's so active. Another one goes hand in hand with the vitamin D and calcium is magnesium. We also have vitamin K, I feel, and through the report, it kind of shows that vitamin K is pretty available in the average American diet, as is hers. But one thing that I feel is vastly undercovered is the importance of boron. So 3 milligrams for bone health of boron. It is a huge, it's just an incredibly important micronutrient for both bone and joint and ligament health. And then everything else, vitamin C, zinc, copper, everything else in the Orthopedics Journal reported is pretty sufficient and available in the average American diet, which I feel hers is pretty on par with, other than her love for ice cream. And also, I got more research from Nursing Open, another medical journal. They performed a study and to relate the aim of or equate the impact of fall prevention education sessions on fall risk knowledge, and to use fall prevention interventions on the number of falls in a community dwelling older person attending physical therapy. So basically, they were just trying to equate what is the relation between fall risk and knowledge and actual falls. So pretty basic, and the results, everything you would expect. Post-interventional findings identify that this population also had a higher number of participants using fall prevention interventions at home, and a reduction of the number of falls noted compared with their previous years. So it's just kind of showing that fall prevention works. It's really not their fight against wanting to do fall interventions. It's just kind of introducing these preventive measures to this population that they're actually quite susceptible to, or receptive to. I also got I'll cover that one later. And we already covered that. All right. So after doing this, I had a short-term goal before even after kind of establishing this meeting. It was the patient will relate the intent to use safety measures to prevent falls by the end of the home health visit, which was the first visit I was in. So we kind of actually went around her house at this point, and I had her identify the fall risks. After we've gone through the YouTube video that they kind of explained, also like a lot of the CDC printouts that I had, throw rugs everywhere. We got rid of all of them. Additionally, I actually picked her up some no-slip socks or slippers. They have grippers on the bottom because she would usually walk around with her kind of normal traditional slippers that they didn't really have too much grip on the bottom, or at least it weren't worn off at that point. Also for her bathroom rugs, we put no slip underneath because bathroom rugs are actually quite important for the slippery linoleum. She was also well done with her bars, getting in and out of the tub, and also like to level down to the toilet. But and let's see. Yes, and then also her exercise room, because like I said, she's actually very active. She likes to do a lot of she does exercises every single day. Her exercise room is on the second floor of her house. She only has 2 floors. It's like the only room up there. she completely refused to move that room anywhere else, but the railing was actually a little bit loose there, so I just took the opportunity to go ahead and tighten that down. So I feel like she did very well of actually pointed out, like after we watched the video, she's like, oh, there's a throw rug, and like, oh, we just looking at other things like in the house that like kind of generally cause for falls. Just a lot of things like on the floor. But she keeps the house very clean, so there. I think that was actually the biggest point. Um, and then, and okay, all my outcomes and interventions were primary care. It was all preventative. So, like I said, she's just at risk for falls, so everything that we did was purely preventative. All right. And then the limitations that I felt of the teaching is, like I said, she was very stubborn. She has a routine. She does church on uh, 3 days a week: Sunday, Wednesday, and Monday. And then she also does a bunch of different more groups. She's really cut back on a lot of things, like very well for COVID. And she used to do water aerobics, but she doesn't do it anymore. That's why she's works out daily now. She has like an arm crank and various other things. A lot of upper arm strength is what I've noticed, which is also what led me to another thing. This was a point in the video and also the CDC guidelines, which was that exercise to improve balance was actually one of the most beneficial, and this was also told by the Stanford video. And so we actually got her a workout ball for her exercise room because she's fortunately very well off, so she can afford to actually do all these preventative measures. And the important one about this one is it actually has a base on it, so the ball's not going to be slipping anywhere, and also some grips. And the exercise that went over in the video was just a bouncing motion. You're not getting up and falling down constantly, as well. And then, lastly, the last prevention measure was actually something brought on by her two sons that she is very hesitant to use. Is a different branded like life alert button. It fits on your wrist, but she felt like that was kind of a metaphorical leash to her, and that she didn't really like the idea of wearing that, or she was just very inconsistent with wearing it. Which leads me to my last piece of research that I did was from the International Journal of General Medicine, and it was actually directed towards perspectives on using personal alarm systems by older fallers. And the aim was to report the experiences independently living older people who have recently fallen regarding the use of their independent alarm systems. And so she fell underneath I'm not sure, it's probably backwards. She fell underneath the category that she didn't fall, but she did a negative reaction with using the alarm system, does not wear it. She fit the possible intention to change. She saw the benefits as minimal, as she has not suffered a fall yet. And she does not have the barrier of obstructive confusion about how it works. What they found for this population that fit these criteria about the use of their fall alarm device was that they actually responded very well to advertising. So I actually pulled up some various YouTube videos as well as just kind of like the use of them, and one of them was like actually the commercial that you would see of "Help, I've fallen and I can't get up," and she had seen that one before, but advertising actually did seem to resonate with her. And that one was actually established during one of my long-term goals, which the patient will demonstrate and maintain the selective prevention measures by the next home health visit. So I visited her 7 days later after the initial one. She has a pill weekly fill out little one of those discs, and she'd been taking all of her supplements along with her medications. So she was actually doing great at that. She hadn't put in any more of her throw rugs that we removed back down. She said she personally didn't miss them, so that was great. I know that's a big point for a lot of people. But she was not wearing her life alert type device, and so that's what brought me to look up this uh, piece of research and the data that they provided, and that's when we started looking at some advertisements. So partially met on her long-term goal, and next time that I see her, we will see if she's maintaining the use of her personal alarm device. So what could have been done differently? Like I said, I would have loved to move that exercise room down to the first floor and just use the top, the only room on our second floor, just for storage purposes. But also, I feel like maybe I would have liked to include the family more. Her two sons. Those are the only two family that she has in the area. But at the same time, because of this just absolute focus on remaining independent, she likes to make all of her personal health decisions by herself, which again is why, really, to get her to start taking her supplementation, I didn't really tell her. I kind of just provided the information, and she made the decision that, based on the evidence, that sounded great. So everything that she did or we did together was of her own personal accord, and I felt like that was the absolute best way of getting through. But so I would have liked to include the family. I'm not sure if that would have actually been more or less beneficial to if she might have been doing a little bit more fighting back because of that. But and then lastly, my overall reaction to the role of a nurse teacher, it was great. I actually didn't. I knew my client a little bit. I didn't know all the ins and outs. I learned a lot. It was great getting to know her like daily routine and everything, um, and also just a bit of her life story, her medical history, everything like that. That I included in the assessment tool previously, and yeah, I felt really good. I felt like I made a difference. The fact that she actually picked up most of the things that the teachings that I went over, and how receptive she was to them. Because when we did the teaching or how you like to learn survey, she landed at 4 visual, 3 auditory, which I felt really was conducive to the lecture format. But everything else was really good. I felt like I actually made an impact in such a short amount of time, which is so rare in medicine. A lot of times they're for use over time, but I feel like I made an impact, and it was a really good experience, and it gave me a little bit more insight as to what it's like living as a older adult, and also what it's like dealing with that population. So that is all I got. Appreciate it. Thanks so much.